I'm Dr. Garima Sachi. Welcome you all in my YouTube channel. Friends, today I'm going to explain you about the topic psoriasis in English on the demand of few of my non-Hindi patients. So let's discuss about psoriasis. So it is a chronic inflammatory disease of dermis in which abnormal patches occur on the skin. It is a chronic disease in which red, dry, itchy and scaly eruptions occur. 1 crore and 20 lakhs people suffer from it nowadays. Friends, before that, if you have not subscribed my channel till yet, kindly subscribe the channel. Tap the bell icon to get the details of the videos of the next one and kindly see the video till the last, so that at the last I'm going to explain you about some of the medicines for curing this psoriasis. So let's continue with the topic psoriasis. Now let's talk about the varieties of psoriasis. So the first and the most common variety is plaque psoriasis. It is also known as psoriasis vulgaris or chronic stationary psoriasis. It is most common one. 90% of the psoriatic people are having this variety, that is plaque variety. It mainly occurs on elbows, knees, as well as scalp and back. Now, the symptoms of this psoriasis is there is swelling. Along with that, there is dryness, severe dryness, itching at that area, and there is exfoliation of the skin. The patches are red patches having silvery white scaling along with it. So this is the plaque variety, which is the most common variety of psoriasis. Next variety is guttate psoriasis. So it has drop-like lesions or droplet-like lesions. So there may be numerous small drop-shaped lesions which may be red or pink in color. That is guttate variety. And it mainly occurs on trunk, hands, legs, and scalp. So drop-shaped lesion is guttate psoriasis. Next variety is pustular psoriasis. So in this, blisters are formed which is filled with pus, and the surrounded area becomes red, painful, swollen and tender. Next variety is inverse psoriasis, which is also known as flexural psoriasis, because it occurs at the folds of the skin. For example, overweighted abdomen, between buttocks, at the folds of the hand, under armpits, at the region of the genitals. So here red, smooth patches occurs. So this is smooth and not that much scaly as of other varieties. So this is inverse psoriasis. And the last variety is erythrodermic psoriasis, which contains all the symptoms of the rest varieties of the psoriasis. In this, fingernails may also get involved. Fingernails may get loosened, pin-sized depression may occur in the nails, and whitening of nails may occur. So it involves mainly the fingernails. So this is erythrodermic psoriasis. Now let's talk about the causes of the psoriasis. So it may be hereditary because of the familial history. And there are some risk factors like cigarette smoking, alcohol consumption, and lifestyle habits like obesity. And winter may cause increase in it. And along with that, there is a dry skin. So the dryness also leads to this psoriasis. Now let's talk about the pathogenesis of this psoriasis. So normally what happens, there is a recycling process of the skin cells which occurs at 28 to 30 days. So it is a 28 to 30 days cycle in which skin cell get replaced. But in case of psoriasis, it gets replaced within 3 to 4 days, 3 to 5 days, 7 to 14 days. So it gets speeder and faster. So replacement takes too faster than the normal phase. That's why there is exfoliation and scaling occur. Now let's talk about the diagnosis of this psoriasis. So skin examination is more than sufficient. Now we talk about its homeopathic cause, homeopathic cured case, and some of the homeopathic medicines which can be helpful in curing the psoriasis. So the homeopathic cause is separation from family or loved ones. So this separation may lead to the psoriasis at the physical plane. Now let's discuss about one of my cured case of psoriasis now. A female patient aged about 44 years suffering from psoriasis, having itchy eruptions, and the eruptions are mainly on the knees, elbows, legs and even on eyebrows. And a slightest eruption bleeds very frequently and too much, having foul smell, and along with that there is pus formation in those lesions. She was suffering from the psoriasis since last 4 years, and there was exfoliation of the skin along with that. Cracks were there were bleeding too, and too severe bleeding if it gets ruptured. There was too much burning on the skin and she was too restless. Aggravating factors were cold, and along with that sudden change of temperature also leads to the aggravation of this psoriasis. Physical generals: she was very thirsty, chilly patient, and desires icy cold things, ice creams and cold drinks. Mental nature was, she was very extrovert, very loquacious, talkative, magnetism, desire, feeling of being unloved or not cared by anyone. She felt that she has been left alone on a distant island. She was estranged to her family, and now, after being too much loved by everyone, she has a delusion that she has been neglected by everyone, and she becomes estranged from her family and indifferent to everyone. She has been cut off from the family, it's her delusion, and she felt that she has murdered someone, she has done a crime work, she is a criminal. And along with that, she was too much fearful, can't remain in a dark place, can't sleep alone in night in a dark room. And after taking whole case, after taking whole history, we get the delusion that he is a criminal. And on the basis of all the details, we gave Phosphorus 200, and it cured her completely within a period of 10 months. And third month follow-up was the cracks stopped, bleeding stopped, and normally only the vesicles remains. And within a period of 10 months, it gets completely cured. Now let's talk about some of the homeopathic medicines which can be helpful in curing this psoriasis. So the first medicine is Cerinum. So there is dirty, unhealthy skin as if patient has never washed it. Along with that, the eruptions are reddish and dry, scaly eruptions. There is crust formation, overall body, and there is too severe itching. Foul smelling discharge is there from the eruptions, and it disappears in summer and mainly gets aggravated in winter. Along with that, the mental generals of the Cerinum is despair of recovery, despair from these eruptions. He feels that he can never be cured. Fear of poverty is there, fear of infections are there, fear of disease is always there in Cerinum, and there is continuous suicidal thoughts. Patient wants to die from this disease. So this is all about the Cerinum. If these symptoms correspond, it can be helpful in curing this psoriasis. Next medicine is sulfur. So there is dry, unhealthy, scaly skin, and exfoliations are also seen here. There are also reddish eruptions, and every little injury separates, so it can cover pustular psoriasis very well. Itching is more and severe, but it is especially at night, and this itching gets aggravated after bathing, after getting overheated, or especially itching gets aggravated after taking milk. And mental generals of this sulfur is: Rag seems beautiful. He is indifferent to his own appearance, and he is very talkative, loquacious. He can talk endless on any subject or any topic. So his hands and soles are also red and hot, face is also red and hot, and he is a braggart, boaster. So if these symptoms correspond, then the sulfur can be helpful in curing this psoriasis. That's all about this psoriasis. We'll talk something else about in the next video. Kindly don't forget to subscribe my channel and tap the bell icon to get the latest updates of the videos. The clinic address of mine and the contact number is given in the description link. And kindly don't take any medicine without consulting doctor. Stay connected to stay healthy. Thanks for watching.